Hi, welcome. I'm trying to learn medicine today, Buerger's disease, and after we've done it, we're gonna do a bit standing yoga. And if you participate in the standing yoga, then it's very get on risk. And we're talking about illnesses and diseases and internal anatomy and blood system. And this is no medical advice, we're just learning about it. Buerger's disease, I don't know, is it in Buerger's disease? Buerger's disease, whatever. Buerger disease. Severe and progressive obliteration of the small arteries. Okay, there are the arteries in the human body, and there are the big ones, and then there are the smaller ones, and they get severely and progressive obliterated. And it is mainly in the legs and feet, though the hands and arms are often involved. Okay, the smaller arteries of, that's interesting, why the smaller one? Okay, the smaller arteries of the leg and feet, and also maybe somewhere else, are getting severely and progressively obliterated. No, I'm not sure what the word obliterated means. It is seen mainly in men under the age of 40 who are heavy smokers. Okay, mostly male people do it have and under the age of 40, and most of them are smoking a lot. Cigarettes. Sections of the arteries and veins become inflamed and blocked. Okay, these small arteries somewhere in the legs and feet are getting inflamed and then blocked. New blood channels develop, but the condition recurs at intervals over several years. Okay, I think they are now obliterated, these arteries, or blocked, inflamed, and are closed, and the body searches new ways, but they also become then blocked. Symptoms: pain in the feet and legs, which may occur at rest as well as on exertion. So pain in feet and leg. Cold feet, which may be discolored red or blue. So red or blue feet which are painful. Numbness also, numbness of the feet. Burning, pins and needles of the feet. Just say discoloration of the feet and toes. So we're getting discolored red and blue and also discoloration of feet and toes. Recurring bouts of inflammation and pain in leg veins. Thrombophlebitis. Okay, pain in feet and leg, cold feet, red and blue feet, numbness of the feet, burning, pins and needles of the feet, discoloration of feet and toes, recurring bouts of inflammation and pain in leg veins, thrombophlebitis. Duration. The symptoms will persist and will become worse without treatment. Causes. The exact cause is unknown. This book is from the 80s. Maybe more is known. The exact cause is unknown, though the disease is almost always linked with heavy smoking. I understand the sentence, but I think what I mean is that they actually, most of the times, if they have someone who has Buerger's disease, that person is a heavy smoker. That do they mean with linked to it. I try to understand what it actually means now. Complications. Gangrene, which would involve amputation. Whatever gangrene is, it involves amputation. And amputation is cutting off of. I said we're talking about medical amputation, and we're talking about medical things, so I'm talking a bit more loosely. Amputation, that means to cut a body part off. So not the legs or feet or toes. Treatment in the home. Stop smoking, do they say. Reduce weight to normal, so they're saying not be obese. Take particular care of your feet. Cut toenails regularly and carefully, and wear well-fitting shoes. And how does that help? I mean, maybe people should do it anyway, but whatever. Cut the toenails regularly and carefully, and wear well-fitting shoes. But also, not be overweight and stop to smoke. When you consult a doctor, if there are any of the above symptoms suggesting poor circulation of the feet and legs. Okay, you should consult the doctor, do they say, if there's pain in the feet and legs, cold feet, red or blue, numbness of the feet, burning, pins and needles, discoloration, recurring bouts of inflammation. Thrombophlebitis. For those with established disease, for those with established disease, when there is any sudden change in circulation, or if the skin produces ulcers or shows discoloration. Okay, for people who have a disease already, brought forward to the doctor, and it's clear that they have Buerger's disease. I don't get the name clear. If it's not Buerger, I don't get the name clear. Okay, if there is the disease already registered, I don't find the proper name, established, whatever, and there is a change, like getting an ulcer or discoloration. I don't really understand what the ulcer is, but I understand it as a bone which just does not heal. I came across ulcerative, whatever, bone, or whatever it was. And I, for the first time I looked properly to the name, I was always focusing on the active because it's not active, it's active. Why is there no C? Why it's not ulcerative colitis? Why is the word of a disease not that there is something wrong and it is active? Like ulcerative colitis. Why is it not active? Why is it active? I was always focusing on that part, and now I saw the first word is ulcer. And I saw the graphic to it. Is ulcerative colitis actually an ulcer? I don't know what exactly, but something in the intestines, in the stomach, maybe it's in the colon, the colitis, somewhere in the digestive tract. Is that actually an ulcer? Is ulcerative colitis an ulcer? I thought it would be something completely different. If it actually would be an ulcer. Okay, where were we? If people get an ulcer, they should see the doctor. What the doctor might do: arrange for an assessment of the circulation by ultrasound and X-rays using dye solutions injected into the circulation to outline the arteries. Okay, they're doing X-rays and ultrasound, and they, professionally in the hospital, are injecting something to see the arteries better. Give general advice such as stop smoking. We're giving people advice to stop the smoke. And if gangrene has developed, whatever that is that can cause these amputations, or is beginning, he or she will suggest surgery to try to improve the circulation by cutting the nerves controlling the arteries. This is known as sympathectomy. That sounds horrible. And not a word. Cutting the nerves so that the arteries who are getting gangrene do not get this gangrene, which would lead to amputation. Prevention. Stop smoking, as this is the only known factor influencing the disease. But this book is 40 years old. Maybe we found something else. Outlook. Without treatment, the outlook is poor. Ulcers on the toes and feet may occur and lead eventually to gangrene that requires amputation. If smoking is abandoned, treatment usually improves the condition considerably. Actually, yes, but we said that they are blocked and then new ones form, which will get again obstructed or obliterated or whatever the word now is. Okay, if a person keeps smoking, at least with medicine for bronchitis, that person actually, it gets worse, it gets gangrenes, ulcers, and they get amputations. But if they stop to smoke, the condition gets considerably better. Now, that was now this Buerger's disease. If you were here for medicine, Buerger's disease, you can go directly to the next part. We have now 6 minutes for standing yoga. If you participate in standing yoga, then it's better the own feet are standing together and do the heel swings, breathe in the arms down. And out the arms down. Again, in the arms down. And out the arms down. Again, in the arms down. And out the arms down. Now again, the arms up. And out arm them to the side of the police officer. Again, in the arms up. And out arm them to the other side. And in the arms up. Make an inch space between your toes and breathe out to one side. Breathe in into the middle. And out and sink a bit down. Hide and seek plank, palm tree. Breathe again in and up. And out, open to one side. Again in into the middle. And out and down. Again in and up. And out on the arms down. Let's do the crab in the morning. Leg shoulder before the part. Breathe in the arms up. And breathe out and draw the shoulder blades together. Again in the arms up. And out and draw the shoulder blades together. Breathe in the arms up. Bring the feet together. Hands together and breathe out and lean back, feet in the bend. Breathe in into the middle. And out and again back. Breathe in into the middle. And out, lean onto the knees, making almost 2 inches. An inch space between the feet. Breathe in. And out, make a round back. Breathe again into the middle. And out back. A belly of the back. Again in. And out, your head. A hill of the back, again in, and out, and round back, again in, and out we can round back up, making at the top of the back with the shoulder. Let's make one more exercise like that. Feet are staying 1 inch space apart, the arms up, without opening the arms to one side, breathing in into the middle, and out we're going down into a chair, breathing come halfway up, higher up, and out as we're coming up. Breathe in a UJYL. Breathe out, open to the side. Again in. And out we're going again down into a chair. Breathe in, come halfway up. Higher up. And out and again up. Now breathe in and come up onto tiptoes. And stay on tiptoes, breathe out and sink slowly down into the full chair. Breathe in, come up. And out and down. Let's do it one more time. And out and down. Again in. And now with the down diving dolphin, bring the arms over the sides down, the feet together, and again down. Now the moment. Breathe in and the right leg. And breathe out and stretch the left leg. Breathe in and change. And breathe out and stretch the right leg. Breathe in and change. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Breathe again in. And out and both legs straight. Another penguin. Breathe in and lift the right hand up to the sky. Breathe out and bend the left knee. Look up the right shoulder to the right hand. Breathe in and hand again down. And out and down. Breathe in and lift the left hand up to the sky. Breathe out, bend the right knee, look up the left shoulder to the left hand. Breathe in, hand in, and out and down. Now we're doing the pelican. Make a hand lift space between the toes, shift the weight to the heels, and breathe in and go down. And out and up. Bring it in and down. And out and down. Bring it in and down. And out and up. Now we tribal shades counterweights. Take hold on the elbows and gently swing from side to side. Hands again down, close to the feet, and breathe in and come halfway up with a straight back on calf flat. And out and down. Again, in halfway up, straight back, and out and down. Now breathe in, come up, way up, down this one. Hands together and hands down. Let's do this stretch of Venus. Leg shoulder before the body, define the fingers behind the back, bring them over to one side, breathe in, shoulders back, turn up. And breathe out, turn the head slowly over to the side of the hands and the chin down to the clavicle. Breathe in. And out and pull the arm in and the shoulder down. Breathe again and lift the arm, the head. Bring it over to the other side and also the hands over to the side. Breathe again in. And out. Head down to the clavicle. And pull the arm in and the shoulder down. Breathe again and lift the gaze. Back and down. And we're doing the sky hugger. Breathe in, lift the arms up. Breathe out, the arms back up the chest of the sky. Breathe again and the arms up. and out and down. Again in, and out and down. Let's do the eagle swings, one of them, behind the arms up, and out and down. And last move with the cactus, collecting its stings in the evening, breathe in, the arms up. Bring the hands to touch, lower the hands down to heart set. That was the standing yoga. I thank you very much, and until next time.